To that, I do want to give a update on COVID-19 in Calhoun County. So just we do have we've reached over 2,600 total cases, but again, as we continue to say, that will continue to go up. So we like to use other metrics to kind of see how we're doing as a community. And we peaked with our highest case numbers per week in our hospitalizations in the beginning of August, and we have been trending downward since then. And in the past 7 days, we've only had 163 new cases in just the 7 days, so that's amazing signs. And then we've kind of been in the mid 20s for hospitalizations at any given day. Today, we currently have 29. And at our peak, we were right at almost 60. So it's definitely a good sign seeing the lower numbers of new cases per week and the lower hospitalizations. And we can contribute that to how well the community is doing in wearing their masks, socially distancing, and continuing to wash your hands and sanitize surfaces and things like that. So we continue and encourage you to continue doing those things. And now we'll kind of turn to a little bit of stress management during this time. So is there anything else that you'd like to say about the team and kind of what you guys do?
There's one area that I'd like for Erin to address for the community's response to the coronavirus, and that is our community helpline. And she's been instrumental with that. So if you'd just take a minute to talk about that.
Our team has been very proud to provide trained, confidential volunteers to partner with the Occupational Health and Wellness Program at RMC. They're doing the testing for the hospital, and as a resource, they've set up a line that the community can reach out to get information on symptoms, to identify where they can get tested, what is available in the different categories where they may have rapid testing, how to determine if they need a test, to talk through situations. And our volunteers have made a very meaningful impact on the community. It's our pleasure to be there and partner with the Wellness Center and RMC to deliver this service.
Right, that is awesome. Do you know the number off the top of your head?
I don't. Some
Okay.
some days we've seen over 65, other days it's lower. We talk them through the intake process if they choose to be tested, and then their testing is done at the RMC Mediplex.
Okay.
So we cover not only the intake for the screening, but a wide variety of other questions that people have.
Okay. Well, that's definitely a good way to help the community during such a time as this.
Absolutely.
So let us, I guess, turn to the stress management side of things.
Okay.
Can you tell me a little bit more about stress?
Absolutely. What I'd like to talk to you, Tiffany, is about stress under normal conditions. And in stress management, we talk about healthy stress, and that's the stress that helps us get up in the morning, go to work, dress appropriately, present ourselves appropriately. That's the normal stress of life that we all operate under. And then there's distress, where there's elevated stress and we're having to work a little bit harder to maintain ourselves, whether it's because we've lost sleep and so we're not thinking as clearly as we might, or we've gotten a troubling medical diagnosis, so there's anxiety or there's fear that's impacting us, and that's distress. And we can still function, but we have to work at it a little bit harder. And then the final stage is dysfunction, where the dose of stress is so heavy, so intense, or it's extended for such a long period of time that we really find it hard to normal function. So now, when you talk about the pandemic, as you talked about the numbers today that are reflected, I have a perfect illustration of how stress is being impacted in our communities. in the Bible Belt, there was a pastor that was talking to me recently, and he says, I'm having a hard time managing our church because some are stressed and they don't want to come back to church and they're concerned about coming back to church. And then there are others who are saying, there's no problem, let's go back to church, let's get busy, get the economy going. And so managing that is stressful, and those relationships are interwoven within our communities. Mm-hmm. That's just one simple illustration of how the stress is being manifested in our community.
Right, right.
Mm-hmm.
And can we break down stress anymore as like different types of stress? I know that you had kind of talked about kind of stress building up and how that affects us.
Yeah, we typically see stress in two different forms. We see an acute stress where it might be caused by a single very, very powerful incident, like maybe a car accident or a sudden death in your family. And that causes stress immediately. Mm-hmm. And then you deal with it, and over the next few weeks it goes away. However, what we've seen with the pandemic is what we would term as cumulative stress. We have a lot of unknowns. We are not really sure when this is going away. And this started sometime in February or March, and it continues to this day. We still have high numbers. We still have people that are continuing to get sick. We have relatives that we know and friends and family that we know that have been impacted by it in terms of their jobs, or they've been impacted with family members who've been ill or actually have passed away because of that. Mm-hmm. So that's a cumulative stress. It's built up over and over again over time, and we don't really see an end to the other side. So that's becoming a bigger issue for us in this situation.
Right.
A lot of the incidents that we deal with as a stress management team are those individual incidents where we respond maybe to a fire department who has had a fatality of a fireman in a fire, and they get over that and they go on about their business. Or we have a bad incident where we may see a child that dies at a school, and we go into the school and do that, and then there's a week or two of adjustment, and pretty much life returns to normal. But with this pandemic, it just goes on, and we don't see an end to it, and there's possibly another wave coming after Labor Day. So.
Right. And can you kind of maybe give an illustration or explain a little bit more about the building up of stress? Is one day worse than the other, or are they all building?
We have a good example that someone in one of our interventions gave us. He said his dad always told him that you can let life build up like water in a bucket. He said there's really not a lot of difference in the first few drops that go in the bottom of the bucket and the last few drops that make the bucket overflow. Right. The key when you have cumulative stress is to figure out ways in your life that you can get rid of some of that stress along so that the bucket doesn't always get full and overflow.
Right.
We always hear the illustration where life is tough at work, so the guy comes home and he yells at his wife, who yells at the kids, who kick the dog chases the cat, and the cat says, "What happened?" They don't really know what's going on. And sometimes we allow stress in our life to do that. We let it build up, and it just overflows and just comes out in a way that we're not really expecting for it to. But if we find ways of coping with the stress to keep it from building up accumulatively, allow some of it to come out a little bit at a time before it builds up, then we don't have that explosion or that overflow.
Right. No, that's very true. So, how can we be aware of our stress, or how does stress manifest itself in our lives?
One of the things that we know is coronavirus has symptoms that you can identify. Stress is very similar to that in that it can occur in one of 5 areas: physical, emotional, cognitive or thinking, behavioral, or spiritual needs. And the feelings that come out, the behaviors that come out, which may be very unlike normal for that person, are indeed normal reactions to a very abnormal situation, a very unusual situation. The response can be immediate, or it can be delayed. It is a very individual kind of thing and unique to each person. For instance, a physical response may be fatigue or chest pains. Emotional may be numbness, fear, depression. Cognitive may be confusion. You just can't think straight or poor concentration. Behavioral may end up being very erratic responses, loss of appetite or overuse of alcohol or drugs. Or spiritual, maybe questioning why or having doubts. They are all documented as normal responses when stress accumulates or builds. And they are personal. You may see a family member behaving in a way you never have before, or a coworker, or a child. And knowing how to identify the difference between their usual behavior and their response to stress is one of the ways we can really be available to help that person and help them try to rebalance their life. With emergency management staff, they can't control when there is going to be a disaster or a crisis, an accident. They cannot control a lot of the variables in which they work. They know they're going to have stress, but learning to identify it and manage it is a critical component. And because we may not be aware of our own situations, being caring and observant enough of a family member, a child, a coworker, and helping them in a caring way identify that they may be exhibiting some stress and helping them work through are very constructive things to do as a team in a partnership. It may resolve itself over a period of time, and if it doesn't diminish, then we would encourage them to seek additional help or additional support in finding good coping skills, good means of addressing their stress so it's not potentially interfering with their functioning or their relationships.
Right. So that they don't necessarily get to the level of dysfunctioning.
Yes,
Right.
exactly.
Everyday life.
Exactly.
And with this pandemic, we see people that have had positive, have seen positive impacts based on what's going on, and others that have seen negative. One of the things that we saw early on was we had family members that were getting to spend more time with each other. So that was good for them. They were able to eat dinner together, spend time together, do activities together as a family, because a lot of the outside activities that children maybe were involved in, like sports and other things, were not meeting. So they were thrown together, and they were allowed to do things like put puzzles together and learn, watch movies together at home and eat meals together. So that was a very, very positive thing. There was also a lot of the things that were negative aspects of it. The fact that you spend too much time with your family, they start getting on your nerves. So it can be the two sides of the same coin. You may enjoy being with your family, but you don't want to be with them too much. And then we see a lot of the unknowns that, again, Aaron was talking about, that add stress to your life. We don't really know sometimes what the real we didn't know for a while what the real transmission pattern was, or when it was going to hit Calhoun County, because for a long time we were in the very, very low numbers, and everybody around us was having higher numbers. What's going on and why are we not getting it? And then all of a sudden it did hit us, and that put a lot of extra stress on our emergency management folks, as well as our hospital staff and medical professionals. And then they were going home and having to work extra shifts. So all of these different things have had different impacts on our family as far as the way the pandemic has manifested itself in stress in our lives.
Right.
So being aware of how it is impacting you has a ripple effect in how it can impact others also.
Right. That's very, very good points. And I have heard, about the importance, especially, we talk a lot about this in emergency management as well, of resistance, resilience, and recovery. And so can you help us understand how important these three areas are for people to successfully deal with stress during COVID-19?
Well, resistance for us is a learned coping skill. In public safety, they are able to respond to some very high stress situations and perform at a very high level where the average person would not be able to do that. That's a learned coping skill for them, resistance. But just the average person, we learn to deal with stress because it's a part of life. We learn to deal with sadness and grief. It's a part of life. And so we learn how to do it. We handle it differently, but we all learn how to be resistant during challenging times. The pandemic is a uniquely challenging environment we find ourselves in, and that's where the word resiliency becomes important because we're having to maintain ourselves. As Wayne said, we're 6 months plus
Right.
in this with no clear end in sight. And so being able to be resilient and handle the changes, and change creates stress, is very, very important to us. And the changes that are taking place impact our lives. I know the EMA was concerned about what's going to happen when they go back to school. We're seeing that played out, where children and families get excited about going back to school, and they're going to play a football game, and then yesterday we had a game canceled the day of, and so that ebb and flow makes it very challenging.
Right.
To be resilient through that is something that we have to work very diligently and be very intentional about. And the third part of that is recovery. Everybody's entitled to a bad day because we're going to reach a breaking point, whoever we are, in our relationships. And so to recover is the ability to go back and regain that normal state of homeostasis or operating. So those three words are really important for us as a community. And as a community, and as which breaks down to individuals and families, we have to become very intentional about how do we manage the stress, which breaks it down into clear communication and setting goals, establishing a routine that is we can maintain, and order, because life is better when we have that. And so those are the things. Wayne likes to talk about resiliency as lifting weights. And a person who lifts weights can maintain resiliency and strength. And the same is true in terms of managing our own emotional level. We can learn how to do that better.
Right. And so we've talked a little bit about what stress is, how stress seems to manifest itself in our lives. So what are some healthy coping skills that we can use to mitigate and help against some of the stress?
I think if we look at the way we live our lives and some of the things that we just take for granted and normally do, we tend to let those slide in times of stress. I told someone the other day, I think I've eaten more French fries in the last 6 months than I did in the last 6 years before that, just simply because it was easier to go through a fast food during a time of stress when I was busy and doing things than it was to go home and cook a meal.
Yeah.
We weren't going to the grocery store as often. Maybe the pantry wasn't quite as full, didn't have as much of a variety. So rather than make that choice and go home and do it, just go through the fast food and grab something to eat.
Right.
So diet is one thing. We need to make sure that we maintain a healthy diet, because in order to keep our physical body going, to be able to react to stress and all the things that are happening in our body, we have to eat well and make sure that we're taking care of our bodies. So taking care of our bodies in that area, as well as getting proper rest. A lot of times with the pandemic, we've had to work different shifts, or we may be working in a different location, or we might be working from home, so we're much more sedentary, so we're not exercising properly. So I think those three things are big. Your diet, making sure you eat well, drink plenty of water, keep hydrated, exercise, do some physical activity. Don't just sit on the couch and become a couch potato because you can't go out and do things like you used to. and making sure that we maintain that healthy diet as well. All those things are good for us.
Yeah. So I may need to stop eating as many French fries
Yeah, don't eat French fries.
and go for a walk or a run. Yes.
Yeah.
That's
I found it's a lot easier to have potato chips and cookies lying around than it is to have healthy things like carrots and apples and bananas.
Right. Okay. So are there any other key things that you guys want to share with us about stress management?
I think it goes along with what I was talking about is maintaining a healthy balance in life. Doing things in moderation. If you're going to do things like eat, you don't want to overeat, but you want to eat healthy foods. You want to maintain your work life. If you're working at home, it's a lot of times easy to let some things slide at home because you're working from home. You don't clean as much as you used to. You may not fold the laundry that's been in the dryer for 3 days because you don't really have to dress up to go to work. You can wear your jeans around the house, whatever. So maintaining that healthy balance, doing the things that you normally would do to maintain a healthy lifestyle, like doing the laundry, cleaning the house, doing those things that you would normally do, maintaining that routine is good. And also looking at what you normally do to cope with stress and see if that's still continuing to work for you. Sometimes when you're under more stress, your normal coping skills may not really be working for you. You may need to try something new.
Right.
So just having a variety of activities that you can do. Making major life decisions is also probably not a good idea during a time of stress.
Right.
But keeping that routine and doing the normal daily routine, things that you can see quick results with, make a big difference.
Aaron does a good job of helping us understand cautions that we need to be careful about when it comes to excesses.
Well, when you look at risk factors and you look at some of those 5 categories of behaviors that show stress, some of them are much more serious than others, where you may be using alcohol or drugs to ineffectively cope with things. You may use behaviors that would alienate you from families or jeopardize your functioning at work. You may not be aware that a stressor is presenting itself in a negative way and begin to feel very out of control, very unhealthy, very desperate to get a handle on your life, and yet you're doing things that are causing you to go into the negative rather than the positive behaviors. So looking at those areas where you may see yourself, your family member, your coworker encroaching in those dangerous areas, and try to get a handle on them. Reach out for help. Ask someone to give you, in a kind and objective way, their impression of how you're doing, and if there are areas that are really scaring your friends and your family, take their cautions seriously and try to get them or someone else who may be a specialist to help you back into control in those areas.
You stress with us the importance of talking about the pandemic's impact and with so many of our people in our community being isolated because they are high risk, and so they're staying home, which they're ordered to do, and we all applaud that. But the isolation itself can be a stress factor because then they don't have the opportunity to go to the senior center or to the daycare or things of that nature. So recognizing where we are in this process is important, and engaging wherever we can in whatever means we can, either by telephone or reaching out, staying connected as people will be very important to lower the stress level and prevent people from slipping into some really troubling situations.
Right.
And I think that one of the things that we're going to come out of this, that's one of the positive things, we will come out of this And I think we'll probably have a lot of lessons learned, and we may not go back to doing things like we used to do. I know I went to the doctor the other day, and I had to get lab work done, and I called and sat in my car listening to music in the air conditioning, waiting for them to call me, and they called me back, went straight to the lab, got my blood draw, went out, and I looked at my clock, and I had been in the parking lot from the time I drove in the parking lot to the time I left was 15 minutes.
Yeah.
So, that's a good thing. There's some good things
Right.
that come out of this, that you can think about. We've learned how to do Zoom meetings for our team meetings. So, where we
Yes,
don't
true.
have face-to-face meetings where we actually sit down at the table together, but we can do that, from the comfort of our home or wherever we are through a Zoom meeting. So
Right.
we're using technology a little bit different than we normally would. So I think there are some things that probably positive are going to come out of the lessons that we learned from the pandemic.
Right.
So we don't always want to think about it as being negative. There are some positives that can come out of it.
Many businesses, schools have gotten very resourceful and very creative rather than throw their hands up that we can't gather, we can't be in proximity. And we have learned new skills. We have accelerated our ability to communicate from a distance. For those of us who are seniors, I'm proud that we've embraced that, as have a lot of other people. Teachers are learning new skills. Business deals are being done internationally
Right.
in a new way. So, as Wayne says, we have brought this forward, and I hope we can each look at the positive changes that it has created in our lives and continue to explore and expand. Children can teach us a lot, and they are
They can.
great examples of plunging right
Yeah.
in and being innovative and creative. So we do have a lot of shining stars in the midst of some clouds
Right.
that we can move forward with.
Right. Right. Is there anything else that you guys want to share about stress, or you can, if there's somebody that is in the community that is wanting to reach out to your team to come to their organization, can you kind of explain how that works?
When we initially developed the team, we were very intentional that we wanted a team that would be broad-based in concept and that would be able to engage and provide a wide range of services, because we're basically a small community with limited resources. And so the ICSF model is that model, and it affords us the opportunity, Tiffany. We can do some pre-instant training on stress management and prevention, education related to stress management. We're able to do, you all do an excellent job with crisis management briefings, where you're providing information in the midst of a crisis that covers information for a large group of people, and we're able to provide crisis management briefings, or following an event that's been extended, we can do a defusing or debriefing, which is an interactive, emotionally engaging type of interaction that maybe there's a group of people there that are significantly impacted by the pandemic, or if it's not the pandemic, it's just a life event that they're impacted. So we can provide a full range of services for the community, and we do that by volunteers. So there's no cost to those who are asking for the service, and that's good. And we have highly qualified individuals who are trained in their own right and bring their own resume. So we have are very gifted in that regard. If somebody would like to know more about it, they can simply call me as a team leader, and I can provide that number for you. Or they can call the chaplain's office at RMC and say they'd like to know more about the crisis response team. And so those would be the best two ways of contacting us.
Okay.
Okay.
We go out by invitation only, so we're not going out to solicit business. But if an organization wants us to come, we will respond to an invitation from the leadership.
Okay, that's very good to know. So you can either find Ted,
Right, yeah.
or can contact the chaplain service at RMC.
Right.
Okay. Is there any last things or remarks that you would like to say about stress, or?
I would just say for a pandemic, which is uncharted waters, I think our community is doing an excellent job of managing it. I just want to say that
Right.
at every level, at the school levels, our public safety. I keep mentioning that, but I think our community is managing this crisis quite well.
I would like to agree with you. Yes, especially like I said in the beginning, our numbers and our hospitalizations and those type of things, they're down because of things that the community is doing and being diligent in the prevention methods of COVID-19, as far as washing your hands, wearing a mask, watching your distance with people. And so it really speaks volumes of the Calhoun County community. Well, so I want to thank you guys again for being here today to talk to the community and to me. So I would like to say, if you want to stay updated with anything that is related to COVID or non-COVID things in the county, you can go to our website, calhounema.org, and we have all the latest updates about the county on our webpage. And then, of course, we have Facebook, which we're doing this video on now, but we also have Instagram and YouTube and Twitter, where you can get information on all different type of platforms. And so thank you for tuning in today, and we hope you have a great day.
Thanks for the invite.